Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Welcome to Fronteras, A Changing America. I'm Jonny Coker. In today's episode, we'll be taking a look at the world of psychedelic therapy. What types of behavioral health disorders do ketamine and psilocybin treat, and why are some New Mexicans pushing for the legalization of magic mushrooms? I have more in this report. There's an ongoing push to bring psilocybin therapy to New Mexico. Psilocybin, the active ingredient in psychedelic mushrooms, is federally illegal. But advocates say that psychedelics, specifically psilocybin, can help treat individuals with certain behavioral health disorders. Chad Lozano is a veteran and suffers from PTSD related to his deployment in Iraq. He's an advocate of cannabis and psilocybin, and said he avoids prescription medication due to the harm that it's caused to his family.
My oldest sister, she was a veteran herself, and she actually passed away from prescription pills from the VA. And so after she passed away, she was on pretty much all of those and some. I swore to never do that to my parents again. So I've actually told the VA no to all of them, just for the simple fact that I didn't want to go that route.
Currently, only 2 states have legalized psilocybin, but there's ongoing efforts to study the effects of the drug. According to a study conducted by Johns Hopkins University School of Medicine researchers, 54% of participants diagnosed with major depressive disorder were considered in remission 4 weeks after receiving psilocybin treatment. Lozano echoed this sentiment, saying that psilocybin has been beneficial to treating his own PTSD.
With psilocybin, I feel the effects even days after, I've stopped taking it. And it's not like I'm feeling high or anything, it's just I'm getting the benefits of, okay, it's like you learned something, and then you took something from that, and it sticks with you for a little bit.
When KRWG reached out to the New Mexico Department of Health regarding Senate Memorial 12, a spokesperson from the department sent back a written response. Quote, "While Senate Memorial 12 does not allocate any funding for the work, it aligns with the objectives of the New Mexico Department of Health in addressing addiction within the state. Consequently, NMDOH will strive to identify and report on research and program models implemented in other states to inform and support future plans." As a Schedule 1 substance, the DEA says psilocybin has no currently accepted medical use, and there are reports of individuals reacting adversely to the substance. Research on how safe and beneficial psychedelic treatments are for the general public is ongoing. And while medical providers in New Mexico aren't allowed to prescribe psilocybin, there are doctors in the state practicing other forms of psychedelic treatment. Dr. Deb Thorne, co-owner of Soul Trip in Las Cruces, is an advocate of psilocybin treatment and actively uses ketamine therapy with some patients.
I actually went back to Canada to receive some training for psilocybin-assisted therapy. And so coming back to the US and coming back to the state of New Mexico, I continue to use ketamine because it is legal, but I am not able to use psilocybin, which is one substance that could help thousands in this state.
Dr. Thorne said psychedelic treatment could help ease some of the burden on New Mexico's current behavioral health landscape. And while it's not for everybody, it's a tool that can be used to treat individuals who qualify.
This is a powerful adjunct therapy to the mental health industry. And I think that we just need to be open to the possibilities, but do it safely. We need to look at the medical model. We know that cannabis has been received well in that light, and I think we need to look at psilocybin as being, equally a similar path, anyways, to legalizing it for the state if we use it for medical purposes.
Leanne Meadows is one of Dr. Thorne's patients who's undergone ketamine therapy. Meadows said that she has PTSD from trauma that happened when she was a child and that she wasn't making meaningful progress in traditional therapy.
This medicine has helped me to change the way my brain works. I was really able to change the quality of my life and improve the quality of my life through these treatments. And so I think there's a place for psychedelics for people that have been traumatized.
With the momentum gained from this legislative session, advocates are hoping to push for a medical psilocybin program following a similar model of the medical cannabis program so that progress can be made in treating complex behavioral health problems within the surrounding communities. Joining us now is the manager of Oregon's Psilocybin Services section, Angela Allbee. Angela, thanks for joining us today.
Thank you. Happy to be here.
And Angie, as you like to go by Angie, can you tell me about your experience within the psilocybin space? I mean, this is a really unique position that you have working as a state employee for a regulatory agency that oversees this substance that's federally illegal. So what led you to the position that you're in currently?
Yeah, that's a great question. I started off my career doing about a decade of work in the nonprofit sector with individuals experiencing crises and trauma, resettling refugees, working with houseless individuals and survivors of domestic and sexual violence. And then later in my career, for over a decade, I worked in shaping policy in the state of Oregon. And when this opportunity came up, I knew that I had a strong background and sensitivity towards, the potential of psilocybin in healing and wellness and addressing trauma, and then also the policy background to be able to set up this work and operationalize it.
And psilocybin, it does have, a lot of proponents say it does have this very powerful therapeutic uses for things like PTSD and other behavioral health disorders. Can you tell me about your own anecdotes that you may have run into in your own work in terms of helping individuals recover from things that psilocybin may help with?
Well, I think that every individual is different and has a different pathway. And that's why psilocybin services in Oregon is such an opportunity for people, because not everyone heals the same way. Not everyone has the same needs for addressing trauma, crises. And so under this model, clients who are 21 years of age or older can access psilocybin services in Oregon for any reason. It's not a medical or clinical model, so they don't need a referral or a prescription from their provider. They do have to complete a preparation session with a licensed facilitator, and they do have to ensure that they're appropriate for services. But this gives them an opportunity to really have a unique way of addressing their needs and making sure that it's centered on what it is that their approach, what they prefer, and how best they can, walk down that pathway to healing, wellness, or, if they are addressing some kind of mental health or behavioral health condition.
Mm-hmm. And dealing with behavioral health, there are so many things that go into that, even in normal state departments, right? But in your own words, what are the key responsibilities of your department?
Yeah, so we are the regulatory agency for psilocybin licensees. So what that means is that there are 4 license types under this model. We license manufacturers that cultivate the psilocybin, laboratories that test the psilocybin products, the service centers, which are the locations where clients can access psilocybin and have their administration session with a licensed facilitator, and then the licensed facilitators that support clients through those experiences. And then in addition to that, we approve training program curriculum for the facilitator training programs. All students have to complete those training programs before they can apply for a facilitator license. We issue these licenses as well as worker permits, and then we regulate. So we adopt administrative rules to ensure client and product safety under a public health and safety umbrella. And then, we work closely with the community, with our partners and those that are most impacted by the rules to ensure that all of their, perspectives are being heard. And then when we adopt those final rules, those become the regulations that our licensees have to follow. We'll conduct any investigations if we receive complaints from members of the public, clients, or other licensees. And if there's enough evidence that shows that there's a violation of our rules, then we'll take administrative action. And so we ensure client and product safety. We also do a lot of outreach to the community to ensure that, we're understanding how psilocybin may impact their communities and what their needs are so that we can ensure that we're centering equity while we're also implementing this work.
I understand. So, one thing that I really was curious about, and you touched on it a little bit there, is enforcement of these regulations. I mean, how often does your department have to essentially crack down on businesses that may not be doing, the right things in terms of either, whether it's a licensed facilitator or someone, a manufacturer? What does that process even look like in terms of, regulatory crackdowns, I suppose? Maybe not crackdowns, but, making sure that everyone is in compliance.
Absolutely. So I'll start at the beginning, and I think the most important piece is that we provide a significant amount of technical support to our licensees. Even on our website, we've just published our guidance on administrative rules that really, any guidance we've provided to licensees since we issued licenses in the very beginning are available for members of the public and for our licensees. We're available for any licensee to ask questions and to get guidance. And so that's the beginning, is really helping our licensees understand the expectations. Then from there, if there's a violation, we have on our website where people can file a complaint. Then we will open an investigation. We'll talk to witnesses, talk to the licensees themselves, talk to whoever was involved and the complainant, and depending on the situation. And then we'll ask for files, documents, sometimes security footage, and we'll look to see if there's evidence of an administrative violation. Regardless of if there's an administrative violation and there's evidence, we also like to provide a lot of technical support. So even if we don't find the evidence that there's an administrative violation, we think it's important to have a conversation so that the licensee is aware, that perhaps there was a complaint filed, and also that we can be there to support them through the process and understanding what those regulations mean, if there is any, need for clarity. If there is evidence of an administrative violation, we follow the Administrative Procedures Act, which means that we would create a notice and let them know that there's a notice for a proposed administrative action, and then they would have an opportunity to request a hearing within a certain amount of days. If they do request a hearing, an administrative law judge would hear the case and then would proceed with a final order, and then from that final order, it would be decided. If they don't request a hearing, sometimes those administrative actions would then, proceed forward. And it could be anything from, a revocation of a license if it's an egregious act, to a restricted license for a certain amount of days, or it could mean a civil penalty. So there are different categories or levels of violations as far as severity, and that really determines what the administrative action would look like.
And I assume the purpose of all these regulations and things like that is just to make sure that the market is, to use the word again, well regulated, and make sure people are getting, as safe medicine as they can, essentially. But I was wondering, with this, with more people being interested in psilocybin, especially around other states, and New Mexico specifically being in the early stages of looking into, what, medical use exemptions for psilocybin might look like. What is your advice to folks in other states in terms of beginning this whole process of building a regulatory framework in order to get psilocybin into a place where it can be used for medical therapies and other things?
Yeah. So I believe that policy is reflective of the needs of that community. So if we're talking about a state, the needs of that state should be reflected in the policies that are adopted. Oregon voters passed the Oregon Psilocybin Services Act, and so it became Oregon law, and then it directed our agency to begin licensing and regulating. So that's kind of the process in Oregon. I would say that it's important to recognize the thousands of years of use of psilocybin and relationship with psilocybin by indigenous and tribal communities around the world. I think it's very important that, we recognize and understand that when psilocybin was made illegal, a lot of the research halted. And so we're still in a space where we have a lot to learn about psilocybin. So it's important to hold on to two truths. One is that there's thousands of years of information, cultural and anthropological information, and we need to honor and respect that space. And also that there's science and research and other information being published to help us better understand the science behind psilocybin. I think it's important for individuals in the community to understand what's legal and what is in the unregulated space so that they fully understand, they can make an informed decision and decide, how they want to participate if they do want to have a relationship with psilocybin. Many people think that, this is a dispensary model. So we've done a significant amount of education and outreach to make sure that people understand the regulatory model doesn't allow people to purchase psilocybin and take it off site with them. And so I think that really education is so important. People can visit our website and they can look up our scientific literature review that the Psilocybin Advisory Board conducted. They can look at the cultural and anthropological information that we've published to date. And I think it's really important for states to also honor their government-to-government relationships with the federally recognized tribes in their state, as well as other tribal members from other lands and unrecognized tribal lands that may have input or feedback to share. So we've done a lot of learning. We've created a lot of accessibility with Spanish interpretation, American Sign Language interpretation, and CART captioning. We also will honor any other accessibility request. But really, this model must be approachable for all. And it's really difficult because right now insurance won't pay for psilocybin services in Oregon. So we're really taking a collective community approach where we require licensees to create social equity plans. And those licensees, many people have created stipends or sliding scale fees or subsidize the cost of services for clients from certain populations. And so really it's about creating a community relationship, and sometimes as the regulatory agency, we can continue to support that and encourage. We can't create administrative rules around it, but we can be a good community partner and open up spaces to listen. And we do that through public listening sessions, public hearings on rules, and also participation in our rules advisory committees and other spaces. So we really encourage people to visit the website. We have 14,000 plus people on our distribution list, and hopefully that means that people are visiting the website, gaining information, and that we can be supportive partners to other states as well.
And Angie, speaking of those other states, have you, received any sort of requests or communications between, folks from other states who are interested in essentially embarking on this process? Have you talked to anyone, or have you not heard from anyone in that space?
Absolutely. We've had a number of states reach out, many of which are either, looking into what this model is in Oregon. Many folks are from state agencies that, are curious and want to know more information about, how it's going. Others are decision makers that are curious and are setting up, legislation. So it really varies. But, I want to make sure that we're being a resource and a partner, and that hopefully by the precedent and the model that we've set up, we can learn from it, and then, we can learn from other states as they set up whatever models that, they're thinking of or proposing. I think it's important too to recognize that there might be a medical model that comes on board. And I think in Oregon, we can serve very different communities. And so that just means additional access for folks that might not be appropriate for psilocybin services in the regulated framework that we're working in now. Maybe people with more complex diagnoses or higher needs might be better served through that medical model. And some folks might be better served under the Oregon model that we're currently administering, which allows for individual group sessions, outdoor administration sessions, and, other sort of approaches that might be more consistent with, the cultural needs of an individual accessing services. So I think there's a lot to learn, and communication and collaboration is really important to serving people and making sure that these models are consistently evolving with the needs of our states.
And Angie, I mentioned that you're in a unique position working for like psilocybin services section of a state agency. So I'm sure you've run into some roadblocks or hiccups or administrative tape. So anyone who's looking to embark on this journey of essentially regulating psilocybin, what would your main piece of advice be for them?
Well, we were setting up, or I was setting up the section during a COVID response. And so that was a really difficult time. I think that if state agencies are going to be implementing models in their respective states, there's a lot to consider. Are there funds attached to this model? For us in Oregon, the Oregon Psilocybin Services Act created a fee-based structure. So the cost of licensing fees have to cover the cost of our work. That means that licensing fees could be high, could be expensive, and could eliminate many people from participating in the model. We do allow reduced fee rates and have other ways that we've tried to address that issue. But states really need to think about, what kind of resources and support are available, what kind of model would they like to implement in their states, and then really the regulatory piece. What are the benefits of a regulated model? While it might be somewhat expensive in the very beginning, there's also client and product safety, and we have over 100 pages of rules that support client and product safety, and also a client consent model. So the client is always centered in their journey and their experience. And so I think that it's important to really understand the dynamics of that respective state. What supports are available, the sustainability of the model moving forward, and then also just what are the needs of the community and how are you going to engage with them, which I think is really, really important.
I see. And something you mentioned earlier, and I'm glad you did, is the fact that psilocybin has been used as a medicine for, centuries essentially, and New Mexico itself has a large indigenous population. So what's your message to folks who feel like that psilocybin is being appropriated and that it is being westernized and that it's not being treated properly essentially? What is your message to those folks?
Yeah, well, I think that it's an important conversation. In Oregon, the Oregon Psilocybin Services Act is codified in Oregon law, and it directs our agency to implement. So, implementation with a deep respect and understanding for those people that have had a long history and relationship with psilocybin, as well as a lot of knowledge and experience, whether or not they choose to connect and share that information or help create or shape the model within the statutory container. We've tried to look at things like legacy practitioners and how they can step into this space, and also making sure that we have client safety at the very base of everything that we're setting up in Oregon. And so we allow accelerated credit hours for students that are entering training programs. So those training programs can actually award accredited, hours to that student if they've been a practitioner in legacy or lineage practice for some time. So there are things that you can do, social equity plans, making sure that you're honoring your government to government relationship. I think at the end of the day, this is a difficult issue. You're drawing a line around something that's been in the unregulated space for thousands of years, and suddenly saying this is legal and anything outside of that line is not. And that does affect people. So trying to have sensitivity about the impact of regulation is important, and still being able to move forward and do our work that we're charged to do under our law. I think that there's a lot of reciprocity and a lot of conversation that communities can create and learn from. And those learnings can be shared with state agencies as they regulate. And every state will be different. So I think just, nothing about us without us is an important phrase. And I think it's important to engage people even before these models are passed into law, and making sure that there's a lot of conversation happening to respect those Indigenous communities, those tribal communities, and also making sure that communities of color and other communities that have been left out of conversations for decades have an opportunity to approach this conversation and feel as though they're a part of it. I think that It's really important that these models reflect the community needs. And in Oregon, we align with our state health improvement plan, which is called Healthier Together Oregon, that addresses institutional bias, adversity, trauma, toxic stress, behavioral health, economic drivers of health, and then access to equitable preventative health care. So by aligning to the needs that have been identified by the community, we can make a difference in the health and wellness of people. So I think it's just an important balance, and from the very beginning, those conversations should be happening and should continue.
Absolutely. Well, thanks so much for being on the show today. Unfortunately, we are out of time. Angie Allbee is the manager of Oregon's Psilocybin Services section. Thanks so much for being with us today.
Thank you.
That's all for today's episode. Remember, you can stay up to date on the latest local news at krwg.org. For KRWG Public Media, I'm Jonny Coker. We'll see you next time on Fronteras, a Changing America.